Hi everyone, this is Melissa. I'm just going to go over the dissection of the sheep heart. Just going to get my gloves on. So I'm going to go over the external anatomy. The first thing is the visceral pericardium, which is the epicardium that surrounds the heart. It's like a silverish lining. You can see that here. Here we have the apex of the heart. Here we have the base of the heart. There are 4 chambers of the heart, and this is the right atria, the left atria, the left ventricle, and the right ventricle. Okay, so the blood in the right atrium is going to be deoxygenated, and the blood in the left atrium is oxygenated. Let's see. This is the left auricle, and then the left auricle and the right auricle. These are muscle pouches that help increase capacity of the atrium whenever there's blood flow. Let's see, what else? So the left and right ventricles here. This groove here is the intraventricular sulcus, which carries the anterior ventricular artery and part of the ventricular coronary also. So much. Let me use this. This here is considered the pulmonary trunk, and it carries the deoxygenated blood into the 2 pulmonary arteries to the lungs. So we have that here. Hopefully you guys could see that. Let's see. Here we have the aorta, which carries oxygenated blood into the body tissues. The ascending aorta would be done here. And then we don't have the aortic arch because it's not part of this specimen. But it does have 3 blood vessels. But it's not here. Because it's part of the aortic arch. So let's see. Now we have the superior and inferior vena cava. Superior and inferior vena cava. Let's see, now what else do we have? Here we have the anterior ventricular sulcus. What else? So now I'm going to open up the internal anatomy, which we're going to start with the right atrium. I kind of already cut it. I hope that you could see it. We have the inner wall of the right atrium. Let's see. This is so hard. Here on the inner walls of the right atrium, we have the pectinate. These are the muscles. The myocardium is going to be the myocardium here of the right ventricle. Now the left ventricle myocardium is here. So this left ventricle is actually 3 times thicker because it has to create a lot of pressure to pump blood into the aorta and throughout the system and circulation. So this is the myocardium of the left ventricle, which is way thicker than our right one. See that? Yes. Let's see, what else? So the inner surface of the ventricles, we could see the trabecular carne that is here on the inside. And that's also present in the another side, the left side. So the intraventicular septum is going to be seen here towards the back, and it's also visible on both sides. So it's the wall or the lining that separates and divides the two ventricles of the heart. Let's see. The left atrial ventricular valve is going to be seen in the left ventricle, which is on this side. Oops, the thicker one right here. So if you look inside, there's a bicuspid valve here. And the chordic tendineae are these little things here. Let's see. The right ventricle, you could see the tricuspid valve, which is going to be in here, right behind this thicker area. And the chorda tendineae, of course, is going to be here. So we can see the valve behind here, the cusps of the valve. The papillary muscle is going to be seen in here on the linings of the ventricle muscles. Oh my gosh, it's so hard. The pulmonary semilunar valve is going to be in the right ventricle, which is going to be here, and the right one. And the aortic semilunar valve is going to be in the left portion here. So if you could see in here, let's see. I think that is it for now. I went over the exterior and the interior. I hope you guys enjoyed the video, and it was pretty clear. Thank you.